Iliac crest, greater trochanter, halfway, fingers fairly deep, put some resistance on while they lift their leg out. They're doing abduction at the hip. Halfway between the two will be gluteus medius. Underneath gluteus medius is gluteus minimus. Put a little bit of resistance onto their leg and they're just going to lift their leg out towards you. Gluteus medius. Onto the side at the hip region, gluteus medius. Gluteus medius. Primarily we'll be doing abduction at the hip, gluteus medius. This time from the anterior superior iliac spine across to the greater trochanter, so there's a diagonal across there. Spread the fingers, and so in this particular case what we're looking at here is tensor fasciolata, and all that we have to do to locate the muscle in this particular case is roll the leg in, medial rotation, and there's the muscle just in that area just there. Start again from the anterior superior iliac spine, greater trochanter, spread the fingers between the 2 points, and all they have to do is medial rotation and the muscle will just pop up. It does other things as well, flexion and abduction, but medial rotation will actually locate the muscle. Tensor fasciolata, a muscle that puts attention onto the fascia on the lateral side of the leg, which is the iliotibial band. Tensor fasciolata will do flexion at the hip, abduction at the hip, and medial rotation at the hip. Tensor fasciolata, flexion at the hip, abduction at the hip, and medial rotation at the hip. Rectus femoris, so we locate anterior superior iliac spine, tibial tuberosity, just below the patella. Spread your fingers all the way along, and very similar to biceps brachii, it does not attach to the bone underneath there. And all that Mayumi's got to do this time is to lift the leg, keep it straight and lift it off the table. Flexion at the hip. It also does extension at the knee, but flexion of the hip is this narrow muscle that comes up there. Part of the quadriceps muscles, but it's the only one of the quadriceps muscles that does not attach to the femur. It goes over the hip joint. Rectus femoris, part of the quadriceps muscles, and again this does not attach to the femur. It comes from the ilium, 2 attachment points on the ilium, and comes all the way down to the tibia, tibial tuberosity. Rectus femoris. Flexion at the hip and extension at the knee. Rectus femoris. Rectus femoris. Now if we can get Mayumi just to roll the leg out, we're looking for sartorius. Sartorius now will be the bump on the inside of the knee, and again the focal point will be the anterior superior iliac spine. Slide the 2 fingers together and again just do flexion at the hip, and in that central section just there is sartorius, the longest muscle that we have, and again this muscle does not attach to the femur. To start again, if we start with the leg straight, Mayumi rolls the leg out, there's a bump on the inside of the knee, come from the anterior superior iliac spine, the 2 fingers then come together, and then Mayumi is just going to lift the leg off the table. Flexion at the hip is one of the things that it will do. It also done lateral rotation as well. Sartorius. Sartorius. Sartorius is the longest muscle that we have, and it starts from the ilium and goes all the way down to the tibia. It does not attach to the femur. From the ilium to the tibia. It will do lateral rotation at the hip, flexion at the hip, and flexion at the knee. For more of the quadriceps muscles, you just get Mayumi just to bend both knees, slide your hand underneath, put the palm of the hand onto the opposite knee. Vastus medialis is the teardrop muscle. So this will not work unless the leg is straightened fully out. So nice and slowly straighten the leg out. Extension at the knee. Vastus medialis. And just let that drop down really nice and slowly. And if you come to the outside and straighten that out again, that's vastus lateralis. Down we go. Vastus medialis, the teardrop on the inside, straighten the leg out, extension at the knee. Down we go. Come to the lateral side, vastus lateralis, and again does exactly the same kind of thing, straightening out at the knee, extension at the knee. Vastus medialis, vastus lateralis, rectus femoris. The other one of the quadriceps is underneath rectus femoris, which is vastus intermedius. Vastus medialis, rectus femoris, underneath that is vastus intermedius, and vastus lateralis on the outside, the lateral side. All do extension at the knee. The vastus muscles, the remainder of the quadriceps group, so rectus femoris is one, and in this particular section, rectus femoris has been cut away to allow us to see the underneath muscles, the deeper muscles. Vastus medialis. Vastus medialis is on the inside. Vastus lateralis. So vastus lateralis is on the outside. In between the two is vastus intermedius. Vastus medialis. Vastus lateralis. Vastus intermedius, and covering that is rectus, vastus medialis, vastus intermedius, and vastus lateralis. As a group, they will do extension at the knee. They will straighten the leg out when the knee is bent. This time below the knee, tibialis anterior, so the tibia is the bone, and if we just come to the lateral side of the tibia in the proximal half, all that Mayumi is going to do this time is to bring the foot towards the knee, towards the head, dorsiflexion. So there's the muscle just there, and then it changes into tendon, and what we'll now get Mayumi to do from there is just to turn the foot in and then do dorsiflexion, and that's the tendon for tibialis anterior, which then crosses over and comes onto the medial side. Dorsiflexion and inversion. Tibialis anterior is the most medial bone of the lower leg. Tibialis anterior is just lateral to that, and it's in the top half, the proximal half. And the actual tendon crosses over and comes onto the medial side. Tibialis anterior, so that will do dorsiflexion. It will bring the foot up towards the knee, up towards the head. And it will also turn the foot in, so the big toe comes up towards the nose, inversion. Tibialis anterior, dorsiflexion, lifting the foot up, and then turn the foot in, inversion. If we just come a little bit lateral to that, is the peroneus longus. So there's the proximal head of the fibula, peroneus longus. All you need to get Mayumi to do now is to twist the foot so the little toe goes up towards the ear, and that's peroneus longus. Peroneus brevis is underneath there, and the tendon is just in that region just there. Can we just do that again? So there are the tendons for the peroneus muscles. Tibialis anterior, dorsiflexion. Peroneus longus is eversion. Peroneus longus. Peroneus brevis. And there's also a peroneus tertius as well, a third one. These are very much involved in rolling the ankles. So when there's been an injury, rolling the ankles, these will be sore. Peroneus longus, peroneus brevis, and tertius as well. In some cases, people now are calling this fibularis. Perone means fibula. So fibularis is not a new muscle, it's just a different name that's given to the same muscle. Peroneus or fibularis longus, peroneus or fibularis brevis, and then peroneus fibularis tertius. They will do eversion. They will twist the foot so the little toe comes up towards the ear.